Healthcare and public health. Do you support expanding Medicaid in Kansas using federal ACA funds? What should the legislature do to address rural hospital closures and healthcare access? How would you expand access to mental health services across the state?
Okay, so one of the biggest parts of my campaign, as when I ran for Senate 37, was Medicare expansion, and so it was directly going in with what the Democrats had for all of their bills for the expansion, and it gets shot down every time. The number one reason that Republicans gave for my research, as I got on board with that, understanding that that's very important. One, money that we're paying is now being sent out of state, ridiculous. It needs to stay for our rural hospitals. But they say that there's not enough doctors. There's not enough doctors to take that. And so that's why they don't want to expand it, that there won't be any doctors available. Well, there are probably 23 other states that expanded it and worked through that process. So we know it can be done.
Well,
we absolutely know it can be done.
I think we lose doctors because we haven't expanded Medicaid. And
Yep.
so they're going to go over to Colorado where they can have more patients and more money. And
Yep.
we're losing them. They're coming they go to school here
Mhm.
and then they leave.
Mhm.
And so I think expanding Medicaid really solves all these issues.
Yeah.
Like if you expand Medicaid, you're going to save the hospitals and rural access. You're going to have more people with coverage to get mental health care.
Yeah.
It just goes snowball.
And I sit on the Johnson County Mental Health Advisory Board with one of the smartest human beings on the planet, which is Tim DeWeese, and he has ran that department, and we are certified in accolades that come out the yin-yang for this man, for everything that he has done. We have certifications that like other states don't have because that's how hard he has worked to make that work within the county. I would love for him to be able to take that knowledge, and I know they're coming after him for his knowledge, to expand that statewide, to get that mental health, to just make sure that we have that infrastructure available. It's
a real problem because I lived in Wichita and trying to get people mental health care was a problem. There was wait lists. There weren't a lot of options that took their insurance. They take this insurance, not that insurance. And then, even when like my kid, can't go to therapy or whatever because it's like $40-$50 a pop and he's 25 and that's too much, so he can't go once a week, and there's just not options. But I think expanding Medicaid, if you expanded Medicaid, my kid would get Medicaid because he's 25. He's pretty healthy. He doesn't really need it. And really only me and my husband, we have insurance through the ACA, and for the most part we only use it for mental health. For therapy and medications and stuff like that. We do not. That's basically the only reason we have the insurance. We don't really use it for a lot of other stuff besides like routine maintenance. We don't have any ongoing health problems physically. So.
And I know, like I said, House District 14, we're very blessed because the large part of everything that happens in Olathe, and then it backs up into
there's a lot
Park
of stuff here because we try to find things in Topeka and they're not there.
Yeah.
So we have to come here for some specialists and things like that.
But as a state representative, you're not. I'm going to be for 14, but anytime that you can make it for the state.
Well, when you vote, you're impacting the whole state.
Absolutely.
Yeah.
Yeah.